All right. Thank you all so much for joining us. I first want to congratulate all of you on at least being interested in applying into truly the best field out there in medicine. I genuinely love what I do so much, and I would do it all again in a heartbeat. So there's a lot of great places to get a PM&R training in the country, and we are excited to share what we love about ours. I tell this to all the med students I work with, but the best program out there is the right one for you. And if you think that it could be Rutgers-Kessler, then please apply. We would love to meet you. So we'll get started now and kick it off with meeting the team. So this is all of us. Well, not quite in terms of the attendings and faculty, but the residents, fellows, and leadership. So our program, our chair is Dr. Stephen Kirschblum, who is a giant in the field of PM&R and in spinal cord injury medicine. And with all that being said, one of the kindest, most down-to-earth people you'll ever meet. He is super passionate about medical education in a very infectious way. And that really translates across our experience as residents. Our program director is Dr. Monifa Brooks, who has just the best laugh in the world. And if you've heard it once, then you know what I'm talking about. We have two associate program directors, Dr. Roger Liu and Dr. Arlene Edmond. Both of them are actually alumni of our program who stayed. Dr. Liu is interventional sports and spine trained from HSS, and Dr. Edmond is brain injury fellowship trained at Kessler. So they both stayed on with a lot of love for the community. Dr. Botticello is our connection to the Kessler Foundation, which is a research institution that's established and actually physically connected to Kessler Institute of Rehabilitation in West Orange, which is one of our major rotation sites. She helps facilitate our annual resident research course to kind of help empower us with connecting into the world of research, and is a tremendous advocate for us in that way. We have multiple in-house fellowships, spinal cord injury, brain injury, peds rehab, cancer rehab. That was a big draw for me personally when I was in your guys' shoes as a med student, because those in-house fellowships are direct connections and pathways into the infrastructure of applying into fellowship. And that is kind of an increasingly popular career trajectory. So something to think about. The fellows themselves are tremendous teachers and really a valuable assets. There is not a hindrance in the education quality or opportunity for residents because there are fellows present. There's a lot of synergy and emphasis on intentional collaboration between residents and fellows in that way. We have 25 residents. So my class, the PGY4 class, we're class of 988, and then it kind of alternates from there. So 988, 988. And we have all of our wonderful pictures here. I think a huge strength of our program is diversity in really every element. A lot of different life trajectories, multiple people here with this having been the second career that they've had. People who are married with kids, totally single, in a long distance relationship, you name it, we have it. And I think there's something to be learned from all of us, and we're really stronger because of that range in background. And then of course we have Doreen. Doreen is our program coordinator and a major point of contact for all of us and for all of you as applicants. So we have multiple rotation sites, and that was another draw for me to Kessler, was the range in exposure to settings. So we are based out of Kessler Institute for Rehabilitation in West Orange. It's a 150-bed inpatient acute standalone rehab hospital. We also rotate towards or into the VA system, both the East Orange VA Medical Center and Lyons Medical Center, which is not pictured here. But in those sites, we do musculoskeletal outpatient clinic. We have access to a form of a long-term care facility that will rotate through, and then an inpatient spinal cord unit as well. Newark University Hospital is where we see all kinds of outpatient clinics. We go to fluoro there. We see acute consults as well. Our PM&R team is extremely well linked with our surgical teams across the board, and they're consulted on almost every trauma that comes in. We also have the opportunity to rotate at the Hospital for Special Surgery, which is the #1 orthopedic hospital in the country. And that's a special kind of opportunity that we have. We can go to the New Jersey Regenerative Institute as well, and St. Barnabas Medical Center for more outpatient clinic and fluoro time.
All right, so I'm going to take over this slide. So talking about a little bit of the education component that we have here at Kessler. Recently, we switched our rotations from 8 to 9 weeks to 6 to 7 weeks. That was to allow, especially my class, because we were interested in a bunch of the pain, interventional sports, and spine, and that kind of gave us the chance to rotate throughout more locations, and it allowed also the PGY2s to have some exposure earlier on. At the beginning, when we started my class, we didn't have a lot of exposure to the outpatient setting, such as the VA. But due to this change, we've seen that the new classes have had the chance to go to the VA relatively early on. So it is still pretty heavy front-loaded for inpatient rehabilitation or rehab at Kessler West Orange itself. But now you have at least a chance to go to the VA and see some of the MSK components if you're interested in that. In terms of didactics, we have protected time every Wednesdays from 8 to 12. At that point, we're not in charge of anything that's happening on the floors. The attendings are relatively self-sufficient in those times, and they get most of the work done. And so you have the chance to just sit there, really learn the stuff. Sharon is revamping a lot of the stuff that we're doing at the didactics component. So we're gearing it towards board related information. So it's really high yield stuff that we want to emphasize. Every first Friday on average, we tend to have grand rounds. And that's basically where we get to invite some speakers. And that's one of the wonderful things about Kessler is that we have a vast network. We get to speak with a lot of people that have been graduates from our program. They come back and they give us some of their insight based on their experiences. So it's pretty cool. We get to invite them and they really enjoy coming and see us in person or in Zoom. Part of that Grand Rounds component, we have a journal club in which we kind of just discuss articles that are of interest to us. And so it ranges from neuro rehab all the way to pain medicine. And that's where the PGY3s kind of highlight some of their strengths when it comes to learning about article analysis, what it means to read a paper that's fundamental for PM&R, and it's pretty high yield stuff for boards as well. Part of the stuff that I do as clinical chief is I want to revamp a lot of the stuff that we do hands-on. We have an ultrasound course that runs on average for 6 to 7 months, in which we go through every single joint and we practice diagnostic components of ultrasound. But we also talk about treatments, how to use the ultrasound for injections. Part of that stuff that we try to emphasize for the hands-on, we, as you can see in the pictures, we're kind of implementing a lot of the hands-on stuff. So we're using meat models to practice ultrasound-guided injections just for target practice. So it's a pretty cool just get together with residents and we get to practice with the ultrasound machines. We have Dr. Todd Stiddick, who is also revamping his Saturday ultrasound workshops so that we get exposure to that. We have EMG didactics as well that we have on an average of 8 weeks. We go through all the big studies that we get to learn in EMG and nerve conduction studies so that people get used to that component. We have the cadaver course where we could practice gross anatomy analysis. We do prosections and trying to work on using the cadavers at the Rutgers Medical School so that we could practice joint injections, but that's something that it's in the works for now. We have an interventional spine course. You could see in the picture, one of our wonderful residents, Ellen, practicing the needle driving in a spine model. One of our co-residents, Ilona Shores, she brought the curriculum for new lifestyle medicine. And so that's some of the stuff that we could implement. So it's a curriculum that you could sign up for, and you could have the chance to sit for the boards for lifestyle medicine. And our program signed up for it, and it's starting to take off this year. And hopefully, once you guys get to us, if you're able to, you're able to be part of that curriculum. And we also have education track, in which we just practice how to be good, teachers for everyone. We have a lot of chance to be a teacher. So medical students come for electives and mandatory rotations. We have teaching workshops with the medical students at the Rutgers Medical School. And we do the physical exam workshop for us, as well as for the students at the medical school. We have a lot of volunteering opportunities. The biggest ones that we have are the marathon in New York City, and we have Operation Beachhead, which we go to the Jersey Shore and we help out spinal cord injury patients that are doing some of the surfing stuff at the beach. So it's a pretty cool chance to do some adaptive sports. In terms of the nitty-gritty stuff, we do have the call schedule. So it's broken down depending on the location that you're at. So the biggest place that we do call is going to be at Kessler, West Orange. That's the proper standalone rehabilitation that we spoke about. That's going to be a 24-hour call. You also have it at Children's Specialized Hospital, and that's basically when you do it as a PGY2. As a PGY3, you only do outpatient pediatrics, so you're not part of the call system anymore. One of the things that I want to be upfront about, and some of the feedback that I've received in the past, is to be really crystal clear about the call. Just like every program that probably has spoken, it mentions that we front load, and so we do front load as a PGY2. Like I said, our rotations are 6 weeks long, and so you should be expected to do at least 1 or 2 days of call per week. So that's a total of 5 or 6 calls per block, depending on the mix of the residents that are there. But that's the typical amount of call. You do take a lot of Saturday weekend calls, and you do a lot of the holiday call as a PGY2. The good thing, and with every PM&R program, for the most part, it kind of tapers off as you become more of a senior. At the VA, you have a home call in which the hospital will call you via phone. And it's basically just very mild orders that you have to place, if anything. The good thing about the VA is that it's an actual hospital, and you do have internal medicine in the hospital. So if something does happen to your patients, you have someone to be there in case of a rapid or a code. The good thing about the VA for the inpatient side is that most of those patients are relatively stable, and it's very seldom that something emergent happens. But you do home call, and again, as a PGY2, you take most of the call about 7 to 10 days in a row, and then it tapers off with seniority. All right, so I'll give it up to Dr. Kim, my other co-resident.
All right. So just going off the cuff here, I'm definitely not as well-spoken or eloquently speaking as my co-residents, but here we go. So I'm in charge of helping to determine the call schedule as well as the vacation schedule. So with regards to vacation, you get a full 4 weeks in a year that can be spread out 1 week at a time. Sometimes you can have a week back to back at the end of a block or at the beginning of a block for a 2-week full vacation. And of course, we do our utmost best to give weekends for flanking the vacation time, so that instead of 5 days from Monday through Friday, that you would typically get 9 days total, especially if you just schedule the vacation for 1 week. Sick days, they roll over, so you get 12 per year. So in your entire 3 years that you're at this residency program, you'll get a total of 36. And that can be used to schedule a doctor's appointment ahead of time, or use it for a sick time that, obviously everyone gets sick, for late notices or changes.
This
Education days.
Sorry.
It's okay. Education days, for each year that you are a resident here, you get a cumulative addition to your total stock of education days. So if you start off as a PGY2, you get 3 educational days total, as a PGY3, 5, and then as a PGY4, 7. And you can stack them up and use them at the very end, or use them in the middle, use them in the beginning. Obviously, in the beginning, you'll only have 3, but it can really be used for anything that's educational interviews, or interviews for fellowship programs, or it can be used for going to conferences or attending conferences. Personal days, they do not roll over, but you get 4 days per year. They can really be used for anything, quite literally anything. Next slide, please. All right, so salary, thank goodness to our union here. They have worked very, very hard to fight on our behalf, got us a huge salary bump. So this year, you can see that we're getting paid roughly $85K. And the contract is nearly over that the union had made with Rutgers, but there's already on the they're already drafting a new one. Annual book allowance, you get $1,300 a year, and that rolls over at the end of your 3 years. You could potentially have $3,900. And conference attendance, it does not come out of this book fund. So the sky's the limit almost, as long as it's reasonable and as long as you're making educational strides and your research is advancing. And lastly, there's also the Kessler annual board review that many residency programs know of and attend. And this is free for all seniors and fellows. All right.
So for all residents, we are required to do a longitudinal graduation project, which you can either start your own idea or jump onto an existing project going on with presentations that are done annually. So as we mentioned before, the Kessler Foundation is a major research institute dedicated to doing research along a wide variety of specialties. So TBI, SCI, stroke, MS, anything. And we are fortunate to be a model system for both TBI and SCI, which is something that personally drew me to the program. So being a model system basically means that you have earned a certain distinction and having access to a very wide array of patient data and a wide database across multiple institutions across the country, which we are fortunate to have both. And in addition, we do a 18-month QI project as well, in addition to the longitudinal graduation research project.
This is your 2-minute reminder. Please feel free to answer the questions in the chat as well. Thank you so much.
All right, thank you. And very briefly, our residency program, I could say, is something that I really hold near and dear to my heart. I felt very welcomed coming here prior to even joining the program this year. We like each other. We spend time with each other outside of residency, going out to eat or just meeting up. All of these pictures are all pretty recent, even seeing a picture here from our own orientation this year.
I think that one of my favorite things about our programs is hands down our attendings, who are not only amazing teachers, but they're all so approachable. As you can see in the top left picture, that's Dr. Kirschblum. He is so busy, but he makes time every week to hold what we call Dr. K rounds, where he keeps it as an open forum and we ask him literally any question about anything. And he has amazing insight into our questions. And everyone's just a really big family. They're so approachable, and none of our residents ever hesitate to ask our attendings anything. And where do our residents go after they graduate? The answer is literally everywhere and in every specialty. Our program is so diverse and gives such general, well-rounded training that, whether you're interested in neuro rehab or more the sports and spine and pain route, our residents match very well. This is the match list from the past 2 years, and we have people going into brain injury, spinal cord injury, also pain and peds, and truly everything. So our program is extremely well-rounded in that sense.
Got it. Thank you so much for your presentation, doctors.